everyone, and welcome to The Care Connection, SMC's podcast where we bring you top-tier care from people you trust. I'm your host, Chelsea, the marketing manager here at SMC. Each episode will dive into everything rural healthcare and more, the challenges, the wins, the people, and the stories that don't always make the headlines. This is your backstage pass to see SMC in a more unfiltered light, straight from the folks who live and breathe this work every day. Whether you're a patient, a neighbor, or just healthcare curious, we're glad you're here. So let's get into it. Joining me today is Dena Herzberg, DCNP, our dermatology specialist here at SMC, and Kelly Kline, ARNP, one of our women's health providers and one of our weight management providers. And they're going to talk about women's health, weight management, and aging gracefully. Thank you both for joining me. Can we learn a little bit about each of you, how you got into medicine or healthcare, how you got to your specialties?
I got into healthcare at a young age, started out as a CNA, then an LPN, RN, got my bachelor's, got my master's, got my postmaster's. And then I got my way into dermatology because I was working here in the walk-in clinic, and our current dermatology provider was going to be leaving, and I had expressed interest in aesthetics and different dermatological related things. So the hospital actually approached me and asked me if I would be interested in doing dermatology. And we found a postmaster certificate program that was very comprehensive to make me feel more comfortable in being like a leader in the field here. And so I did that, and now I've been doing it for 3 years, and that's how I got into dermatology and healthcare. Just always loved health sciences. I am from Clarinda, so local, and here I don't travel here. That is another thing that I get a lot. People ask if I'm here all the time or if I travel from somewhere else. I am fully employed by SMC and here Monday, Tuesday, Wednesday, and Fridays.
Wonderful. And do people need to schedule an appointment and get a referral for you, or can they just come see you?
No, they can just come see me, and they don't need a referral. You don't even have to have a skin issue. You can come talk about skin care. I have a lot of people who come and just want a consultation on what they should be doing for their skin as they age. Other people who do full body exams, which we recommend you do every year. So you don't need necessarily to have an issue to come see me. It can just be a screening visit, a consultation, or a talk. Yeah.
What about you, Kelly?
I am originally from Villisca, the axe murder town of Iowa. Kind of traveled around the world with my husband. He was military. Lived in a variety of places, states, settled in Clarinda, Iowa. So currently live there. I've always been interested in healthcare. Wasn't kind of sure where it would lead me, but started off at Iowa State, got my bachelor's degree in dietetics. I worked as a dietitian for over 10 years in numerous specialties. I've done inpatient, outpatient, wellness centers. What else? I think just every medical setting. I think I was always like intrigued with what the nurses did and like the hands-on patient care, not just, talking and doing tube feedings. And so eventually my husband convinced me just to go for it and got my bachelor's in nursing. Absolutely love that. I was first a NICU nurse, which was an amazing job. And then we moved to Clarinda, Iowa from Des Moines and worked ER, infusion center, med-surg, school nurse for 4 years, which was an experience. And then decided to go back to school to get my nurse practitioner. So I got that. Wasn't quite sure what I wanted to do with it. Just kind of going through the rotations and things. I figured it would just kind of click to what I wanted. And I don't know, I was getting towards a few of my last rotations. I'm like, nothing's really clicked. I don't know. I'd done pediatrics and family practice and a few other specialties. And then I got to my women's health rotation, and it was like day one. It's just, I couldn't wait to go back the next day, and just meshed well with the patients. They were easy to talk to. Just found it all very intriguing, women's health aspects, and just kind of diving into that. I had an amazing preceptor that made me fall in love with it too. We have very similar personalities, and just dove into all aspects of women's healthcare. And when I got a job here, Dr. Woods, he does a lot of our weight management. So I think he realized with my dietetics degree, I could really be a good, team member to kind of promote that, which I absolutely love weight management. It's comfortable to me. I have that nutrition background. Now there's several different, aspects to weight management, but just having that dietary knowledge without having to, necessarily refer them on and, keep the care,
One-stop shop.
Yeah, one-stop shop, because they're seeing me every month. So every month we're just kind of focused on different aspects, but the nutrition background really does benefit, not even my weight management, but women's health as well. So nutrition is important in every aspect, skin too.
I bet it is. We can all probably eat a little bit better. I know I. So let's get into kind of some things that you both share together in your specialties. Like, what is the how and why of skin aging? What things do people look for?
Skin is going to age naturally. So you have natural aging, which involves like collagen breakdown, elastin breakdown, skin cell turnover slows down. So you kind of get that dullness. Hyaluronic acid decreases, so skin is drier. Fat loss occurs, bone loss occurs, so we have more of like the sagging skin. Then you have your environmental factors, which are the sun, one of the major ones. And then pollution, poor nutrition, lack of sleep, hormonal declines would be more of the intrinsic factors or those natural aging factors. And we'll get into a little bit more of that. But all of these things contribute to skin aging. And then a simple analogy to think about for like your skin aging is like if your skin was like a mattress and the collagen was the springs and the elastin is how it bounces back, and then the hyaluronic acid is the padding on the top. Like over time, all of those things are going to eventually kind of break down, and that's what results in the skin sagging. But there's lots of things that we can do to help with the external factors, and then there's things that we can do to help stimulate the internal factors to build collagen and reduce wrinkling and skin sagging and stuff like that. So.
What would you say is like the most common thing you see in our area of people coming to you like, I don't like how my skin is aging? What is the most common thing you see?
I would say that the skin, if we're just talking about anti-aging, the skin laxity and wrinkling is one of the most common things I see. And then also like skin discoloration, which has a lot to do with like your pigment cells and how they age as well. But also the dullness and the lack of hydration in the skin. And then that laxity is going to be more of like your collagen breakdown as we age, the fat loss, the bone loss, and that has a lot to do with like the hormonal factors as well, tying into what Kelly is going to talk about. So hormonal deficiencies can accelerate the aging process. But I would say probably, the wrinkles and the skin sagging and discoloration as far as like aesthetics go.
Gotcha. When you see other patients, like what is the most common thing you see? Like melanoma, what kind of stuff are you coming in with?
So I tell my patients all the time, and we can talk about that some other time too, but the most common thing, the word I say the most throughout the day is seborrheic keratoses, or SK for short, and it is a benign skin growth that occurs with aging. It has to do with aging, sun exposure, but also genetic factors as far as like how many you get. And you guys can Google a picture of those later. You'll see it and you'll be like, oh, I see these on my patients all the time, or I see these on family members or something like that. But that's probably the most common like benign skin lesion that I see. And then as far as skin cancers go, the most common is basal cell, followed by squamous cell, and then melanoma. And unfortunately, we do have, the longer I do this, a fairly high number of melanomas in our area. Yeah.
And is that, you think, attributing to people not taking precautions when they're out in the sun?
I mean, melanoma, it can be caused by the sun. Most generally, it's going to be in a sun-exposed area. You can have genetic risk factors as well, but the biggest risk factor is going to be sun exposure, sunburns, specifically like burning sunburns. And the younger you are when you have those sunburns, actually, the higher risk you are of melanoma later in life. The other thing people don't know is that sun damage is cumulative; it builds over time. So protecting your skin when you're younger. And this is a reason we should educate our young kids in school. Sun damage builds. So you get a nice tan when you're younger, but all this DNA damage is occurring each time you have a sunburn or repeated suntans. Unfortunately, a tan is a sign of sun damage. And so DNA damage is occurring, and then later that damage or fraying of the DNA turns into breaks in the DNA, which turns into mutations later in life. That is when skin cancers occur.
Let's talk about hormone therapy and how hormones affect skin.
So the main hormone, that I talk to women about, if they come in for their well woman, or even if it's a weight management visit, hormones are so important, for all of our functions, head to toe. When a woman comes in, say for a well woman, always ask the questions, are you sexually active? Or, how's your skin, mood, sleep, temperature regulation. And normally, we'll catch someone that has one of those issues. Ultimately, if it's pain with intercourse or chronic vaginal symptoms, recurrent UTIs, things like that, ultimately it does, stem from the loss of estrogen. Estrogen's kind of, like I say, the collagen for our vaginal and bladder tissues. So it keeps them moist, plump, supports that pelvic floor, keeps that bladder lining, nice and thick. And as we lose those estrogen levels, that bladder lining can thin out, our tissues atrophy, things become a little dry down there, can have some itching, odors, things like that. So, hormone therapy, either with creams or, just pills, patches, all kinds of different options to, just replace a little bit of that estrogen loss really is life-changing for a lot of women. Those that weren't sexually active before, have that aspect of their life back. If they are having, even skin-wise, full body skin, they have that thinning of their skin, itching. So it just kind of helps restore that. And then, bladder lining, a lot of women have that incontinence or leakage, recurrent infections. And it really does over time, vaginal, estrogen creams can kind of help restore that plumpness and tissue elasticity to those tissues as well. So I say it is like the collagen, that Dena says, so important. Estrogen just keeps everything strong.
Hair thinning, nails.
Yeah. And that pelvic floor. So it does keep it nice and strong. So it kind of supports all your, your bladder and your uterus and all that. So a lot of times if someone has just a little bit of stress incontinence, vaginal estrogen cream can kind of help that pelvic floor, stabilize it a little bit, lift it, and, really help with just, symptoms like that too. It's very non-invasive. So it's kind of my first line, if a woman has some incontinence issues or, instead of going straight to surgery, let's try a vaginal estrogen cream for 6 to 8 weeks. And half the time it works, half it doesn't, but, it's a non-invasive way to kind of restore that pelvic floor and bladder health. And so hormones are great. I could sit here for hours and talk about hormones, but yeah.
What would you say to a woman who's having these issues, but she's afraid or has guilt about coming in to address them?
I think that's why I kind of bring it up with every patient. Hormones are important in weight management too, not just women, but men. So, I'm constantly assessing, hormone balance. Is this potentially impacting, your ability to lose weight, or they come to me for mood disturbances? Is it really, what's it evolving from? Is it maybe a hormonal deficiency? So maybe just doing some hormone replacement therapy versus throwing some, SSRIs or antidepressants, anti-anxiety medications, just kind of, addressing it. I mean, when appropriate, but just something I talk about a lot. no matter what you come to see me for, we kind of dive deep and we're going to talk about it. Yes, because they are so important. And usually, you can tell someone comes in and, like I say, I'm a mom of 4 and, busy life, and we forget to take care of ourselves. So just kind of always kind of throw that conversation into that, especially with my well womans, really addressing like the sexual health, the, hormonal health, like, what's your quality of life? How can we improve it? Just making it known that they matter and, their quality of life matters. I feel like we've lived in an age for so long that women just deal with it. It's just something that happens to us. But, trying to change that.
It doesn't have to happen.
It doesn't have to happen.
No. Yeah.
We can feel fabulous in our 40s. I think the good Lord or whatever gave me perimenopause early because, I can totally relate to my patients. And, it's a miserable feeling. And I don't want anyone to feel that way when there's, fixes that are safe. And a lot of times women are like, well, I can't afford hormone therapy. Well, I think the thing I want women to know the most is most of it's covered by insurance. Estrogen therapies, progesterone therapies. The only thing that isn't is testosterone, but there's affordable options that we found to kind of, help with that if it's a libido issue or just kind of like energy fatigue, just finding that good balance with everything. But affordability should not have a say, in the management of this because it is very affordable. Just come talk to us and, like I said, most of it, you shouldn't have to pay out of pocket.
Good.
Yeah.
I think people hearing like, don't forget to take care of you is important because I would agree. I think a lot of moms are like, well, I got to do this. I have this to do. I got to work. I got to take care of the kids, the household. And at the end of the day, there's nothing left over for you.
Yep. Or I had 4 kids. I'm going to pee my pants. Well,
you don't have to.
Peeing your pants isn't normal. That's what I always say. No, you don't have to. We can fix it.
I like that.
And not every fix has to be invasive. There's little things we can do. Pelvic floor therapies and, work our way up to the bigger procedures if needed. But I don't want anyone to feel intimidated, to talk about hormones or, any of their issues because I feel all of us in the women's health department are very good at listening to the patient, meeting them, where they're at and what they're ready for, and just, educating them, giving them all the information and letting them make informed decisions for what's best for them.
I think having somebody that is local in the community, I'm sure a lot of you see your neighbors, people that come to you. I think having somebody at that level of, I'm going to meet you where you're at. I'm not going to push you to do something. Mm-hmm. I think that's very helpful. I think a lot of people.
And there's lots of, functional type of, things that some women, they don't want to jump into like the estrogen, progesterone, testosterone. There's a lot of functional therapies, I discuss, just to kind of start them out. Ashwagandha and, I have a whole spiel on, those types of, things that can help too. I'm sure Dena has some, off-label things that she could do once in a while with her skin patients, but just kind of, assessing where they're ready, what they're, willing to do or what they want to do.
Judgment-free zone. I get that a lot too. Like in dermatology, people are like, well, I canceled my appointment because I was out in the sun a lot and I didn't want you to be mad. Or I went to the lake that weekend. I was like, I don't judge you. I have patients who are like, they come to me every year for their skin check because they know they love the sun. They tell me they love the sun, and I'm not going to tell you to stay out of the sun. I'll educate you on how you can protect yourself. But one of those things might just be coming to see me every year just so that we can watch it and catch something early if it does happen. I'm never going to tell people not to be in the sun. I'm never going to judge them for a sunburn. I was there before too. And again, like that's why I'm here. We'll just watch it. It's a judgment-free zone.
I think that's important for people to hear too, because one thing that I've noticed as a pattern through everybody that I've talked to so far throughout this podcast is people are afraid to come in for screenings and certain things because like, well, I don't want to find anything. Yeah. It's like, what's the point of coming? Is
catch it early.
Find something, catch it
Almost
early.
Everything that you catch early is fairly treatable these days with modern, medical sciences. Like finding something early is what you want to do.
Yeah.
And I do have to say, like, a lot of my weight patients, I catch them, they come in for weight management, but I'm like, when did you have your pap smear? When have you had a mammogram? So, it's just kind of the whole person, so you're going to leave there with a well woman appointment.
Right.
And that's sometimes all the push they need. Well, yeah, I just needed someone to schedule it. I just needed that drive to do it. So.
I think a lot of times people have one thing. So, say they're coming in for weight management, that becomes their focus. And then everything else that should also be important is not even thought about. And I think, I'm guilty. I don't think I've been to have my eyes checked in probably 5 years, and I wear glasses every day. So it's just things that, you don't think about it until you're there and somebody's looking at you like, hey, these are also important.
Life is busy.
Life is busy, and your health is important. And while one thing might be your main concern, don't forget, because like these two things, just overall women's health, weight management, and your skincare kind of go hand in hand with the hormones, things like that. They go hand in hand, so you can't have one without addressing the other.
Right. Set them all up in the same month. That's what I do. Then I just remember this is a really bad month for getting all of my screening tests done.
Or
every
the same
year.
day. I'm like, get your pap smear, go to the dentist, and what else?
Get your mammogram.
All on the same day.
Not a bad idea.
Yeah.
Let's get into some of your non-negotiables for skincare, Dena. What do you think is your, like, if you could pick 4 things that every person should do to protect your skin, what would they be?
So this is actually really easy. Vitamin C. So we talked about like the extrinsic factors or environmental factors, and one of them is like the free radicals, the sun, the dirt, the dust, the environment. So vitamin C is a powerful antioxidant, so it's almost going to like protect that collagen. So you're going to naturally reduce collagen over time, but there are things that are going to accelerate that reduction in your collagen. And so vitamin C is a non-negotiable for me, just to protect my skin. So that's something you would put on during the day. It's not a nighttime thing, just to prevent from like free radical damage. And then, and also UV as well. A retinoid. So we say that like every woman should have a retinoid routine. It's like the little black dress of skincare. So a retinoid, we talked about with your aging that you get that dull look to your skin because that skin cell turnover starts to slow down. So this actually accelerates skin cell turnover so your skin can look brighter. It does stimulate collagen production, so you're going to get an acceleration in that. And then also can help with pore size, skin tone, skin texture, discoloration. So a retinoid for sure. And that's usually put on at night. And sometimes people can notice that they'll get some irritation with that. And usually what I recommend is that you slowly work your way up to nightly use. That's really important because if you're not able to do it every night, it's too strong and you need to probably back off the strength that you're doing. So I would start with like over the counter. And then the other thing you can do, because some people have really sensitive skin, is you can sandwich it between your moisturizer. So at night you would put your moisturizer on first, then your retinoid, and then your moisturizer again. So vitamin C, retinol, and then a moisturizer, always a moisturizer, because another thing that happens is you don't hold on to as much hyaluronic acid and moisture in the skin. And so you can also get that dullness. And then also any dehydrated skin is going to look crepey or wrinklier faster. And then sunscreen. So those are my 4. And we obviously know why sunscreen, but 30 SPF or greater, you can get it in almost any moisturizer and any makeup product these days. So there's really no reason, not to have it on. And that's obviously something you would put on in the morning. It's best if you apply it or like reapply it every 2 hours. So technically if you put it on in the morning and then you're out in the sun at like 1 or 2 in the afternoon, you're not going to get a lot of protection from it. So reapplying something that you'd be comfortable reapplying is important. But those are the 4 non-negotiables.
Non-negotiables.
Yes.
I like it. I think when you talk about the vitamin C, I think we should clarify you're talking about a serum.
Yes. And I think there are some that are like kind of cream based, but yes, I like
Not
serum.
The vitamin you would take.
Correct. Yes. No, thank you for clarifying that. Yes.
When
Rub
you're
the
talking
capsule on your face.
and then I was like, oh, the vitamin C you put on your face.
Yes. So it would be a vitamin C serum. L-absorbic acid is what you're looking for in the active ingredients. But there's lots of vitamin C serums out there. You can get some even at Walmart.
How do I know which one to pick? There's 1,000 products on the market.
So L-absorbic acid, the reason I kind of said that in the, you can get any of them, and any of them would be better than none. But the higher percentage, and then you want the one that does say in the active ingredients, L-absorbic acid, because that is pure vitamin C.
L-absorbic acid.
Yeah, L-absorbic, ABSO
Acid, something like that.
Yeah,
Got it.
Just write it down.
I'm writing it down.
Google it. So retinol, not to get too sciencey, but retinol is the inactive version of retinoic acid. So retinol, which is the NOL on the end, is what you can get over the counter. And then you have the pure form of retinol, or the active form, which is retinoic acid, and that's a prescription that you would have to get. Retinol, the difference in the two is the inactive version, which means when you put it on your skin has to convert it into retinoic acid. So you can actually put that one on during the day and it won't hurt anything. I usually still recommend it at night, just so you can sandwich it between the moisturizer and you don't have to worry about looking greasy or something. You can just go to bed and it can do its job. So that's the over-the-counter version. Your body has to convert it. And then the active version, which is retinoic acid, or what we can prescribe, it's already its active version. And that is what we call photoliable, meaning it is sensitive to the sun. It can be deactivated by sunlight. And so that's the reason we put it on at night. So I just kind of, as a general rule of thumb, I have people put it on at night, and whether they're doing over the counter or they're doing the prescription strength. Yeah.
We're going to jump gears really quick and kind of focus a little bit on the weight management side of things, because weight management is not one size fits all. And we talked a little bit about hormone therapy. The people that come to you, what do you say is like your most common types of people that come in? Like, what are the things for weight loss that they're needing to do? Is it hormone deficiency? Is it, just controlling diet? Is it some other factor?
With, my initial weight management, we kind of go over that. It's kind of an in-depth, look, how's your stress? How are you sleeping? How's your mental health? Let's look at your diet, your exercise, all of that plays a part in weight management. You could eat all the right things, exercise, but if your hormones are off, your genetics play a role. If your parents were both, 300 pounds muscular, individuals, realistic goals. And then kind of looking at sleep patterns and just kind of putting it all together. If you're eating right, exercising, doing all the things, and you're just still not losing weight, then I'm going to dive more into hormones, metabolic processes, sleep patterns. Do you have, sleep apnea that's kind of impeding your ability to lose weight? So kind of just doing that initial, listening to the patient, getting in a good look into, what has worked well for them in the past. What diets have they tried? Fad diets. Were they overweight as a child? Was there a certain traumatic event that, all of a sudden they started to gain weight? Or was it you hit 40 and now you have all this, centralized abdominal, weight gain that but you've changed nothing in the past. So just kind of, getting that basic assessment and then working off that, kind of meeting the patient, not to overwhelm them, small sustainable changes. And that's why, every month we kind of build, but working hard not to overwhelm them with anything. The first visit, kind of look into, have they had screening labs, diabetes, how's their thyroid, all their metabolic processes. And then if they are in that kind of menopausal, stage of life, I don't always, check hormones, because if you're not menopausal, they're going to fluctuate no matter where you're at in your cycle. For men, if they come to me for weight management, they've always been this muscular guy, and now they're tired, they're losing their muscle mass, they've lost their libido, they've got that belly that they never had before. Testosterone's a big one to check for them. Testosterone's like estrogen for women, for men.
Yeah. Decreases with age.
Even, my I've had it checked and it's normal. Okay, well, what was normal? Just because it's normal there's a wide range of normal. So you might be, 200, 300, 400 less, on the range than you were, say, 10 years ago. So that's why, you're not sleeping well, your moods are disturbed.
And we don't
your
just treat the
libido.
number, we treat the patient and the symptoms.
Yep, exactly. That's what I've never said. That's why I think a lot of people come to us, or this hormones especially, like, well, don't you need my numbers? Like, you're starting me on hormone therapy. I'm like, no, not really. Not unless you're on testosterone. And they just seem like flabbergasted. But like Dena said, we treat the patient, not the numbers. So if you're still symptomatic on this, let's try to bump it up, or vice versa. But just really listening to the patient, what's important to them. Maybe they don't want to lose 20 pounds. Maybe they just want to build muscle, or just feel better, go down 2 pant sizes, or I've had this dress hanging in my closet that I just really loved and I want to get back into that. Kind of focusing more on the body composition than the actual number on the scale. So we're always taught to be a certain number, and, trying to get my patients out of that mindset and, into like the internal body changes, not just necessarily the number on the scale.
Right.
And shift the focus that way, and have this amazing body comp machine that we use that does all of that. So it's going to tell me your visceral fat, which is important, increased visceral fat for cardiovascular disease and other metabolic processes that put you at risk. Looks at your lean muscle mass, your fat mass, your basal metabolic rate, so the amount of calories it takes you just to function each day, for your body to survive. So I think that's a good one for people to really see, like, wow, I need this many calories without any activity. So a lot of them go, they're in extreme calorie deficits when I see them, and they're like, I'm only eating 500, 800 calories a day. Why am I not losing? So, just changing that mindset to, your body is not going to allow you. It's storing fat. It's using your muscle to survive. And that just eventually slows everything down. So, you're left with the fat mass. You're left with, a lower metabolism. You're left with that abdominal obesity. And just, teaching people, sometimes you have to, to get them to eat more. They think it's counter, productive. Yeah. But long-term wise, you really do see the, the internal changes on that body comp machine. And I think it's more valuable than, any scale or anything. I had my first one. We've only had it for a couple months, but my first patient, 2 months out, and we rescanned her, and she was like, wow, she hadn't changed on the scale, but getting back onto the body comp scale, it was crazy how her lean mass, muscle mass, fat mass, and all that had changed. So
I think we live in an age where everything obviously is on social media. And so you see all of these, super skinny models and actresses, and you're like, oh, I can't eat anything because I want to look that way. And I think getting people to realize, well, that is, one, not real. And two, they have the, perfect diets and everything, but it's not like they're not eating. Right. There's a big difference between, getting the right protein, the right everything you need versus I'm going to only eat 500 calories a day. That might be like one donut your right. for the day. It's not going to do the same thing for you as eating.
Or a coffee, Yeah. I just drank coffee today.
Well, quality matters.
Yeah. And I try to, and it comes back to hormones too. As your testosterone, your estrogen levels decline, your muscle mass does too. So, do we address the hormone therapy with weight management? Of course, we need to get those levels to where they need to be to kind of preserve that muscle mass so we can build the muscle mass and burn, the fat mass. Energy
to exercise.
Yes. I would say that's probably what I just hear throughout the day from people I know is, I just don't have the energy I used to. And I don't think a lot of people think in their head like, oh, this could be a hormonal issue.
A lot of it's sleep too. So sleep apnea. So I screen all my new weight management patients for sleep apnea. Untreated sleep apnea can be detrimental to people. For weight management aspects, it really does mess up with your hunger hormones. So your ghrelin is kind of your hunger guy. That guy's constantly talking to you, that food noise. I'm always hungry. It makes you crave the sugary carbohydrate type foods, your leptin. He's your suppression guy. Like, I'm full. He's kind of knocked to the, wayside. So that ghrelin really does kind of control everything. So So, getting them, if they have sleep apnea, getting that treated, getting that full, getting into those sleep cycles, getting that full rested sleep really does kind of address that fatigue component too. But then when we get to hormones too, that can affect your sleep cycle. So, it's multifaceted, you just have to figure out which piece of the puzzle is missing. There might be all of them missing. There might be a couple, just lots of things to address, but I love
Everybody's different.
I love it. Everyone's different and everyone has their own goals. So
how can people make appointments with you guys?
Call out to the hospital, just request dermatology or request Kelly or weight management. I'll let you speak on yours.
No referrals are ever needed.
Yeah,
so
no referrals. Call out to the hospital, just request an appointment with either one of us.
Wonderful. Now, I know we have an upcoming event for a women's night, kind of aging like fine wine. Can you guys tell me a little bit about that before we go?
I just wanted to, host an event to bring awareness to, this menopausal transition. I feel like a lot of my patients that come in just have no idea they're feeling that way because it is, a hormonal aspect, or their skin changes because, it's what can I do to age better? Just kind of a fun, relaxing night for women to, learn why things happen. What can you do, earlier on to prevent more severe, problems, in that process of, that perimenopausal transition, addressing things early to prevent it, from getting super severe in the end.
Age gracefully.
Yes. Improving quality of life, just why be miserable for, this transition for women can take, 10 to 15 years sometimes. So I would hate for that to impact someone's quality of life when we have treatments right here in town, that are good and effective, and we care about our patients and just want people to know these services are local. Dena provides an abundance of Botox and, other procedures too. I feel like a lot of people aren't aware that she does microneedling to kind of help, in that aging process. Just bring more awareness to what we're capable of here.
Thank you again, Kelly and Dena, for joining us today and talking about these issues. If you would like more information about our Ladies' Night happening August 18th at 5:30 p.m. in the Hartman Room, you can find all of that on our Facebook page under Events. Today's episode was sponsored by Dr. Mo Abdi, our radiation oncologist here at SMC. Thank you, Dr. Mo, for sponsoring this episode. If you're interested in getting involved, you can sponsor an episode of The Care Connection, and all proceeds go to fund the SMC Foundation's Car Seat program. For more information, you can contact me, Chelsea, at 712-246-7074, or feel free to email me anytime at cjuarez@smchospital.com. That wraps up this episode of The Care Connection, a little behind-the-scenes look at SMC. Thank you so much for listening and being part of the Shenandoah Medical Center community. You can follow us on all the social media platforms to keep up with the latest news, what we have going on, and different wellness resources available. We will see you next episode. Thanks again for listening.